So just briefly go through and describe what he's wearing and why these various things are necessary, why these so many layers are.
Okay, so let's start with, he's got a base glove on the lower level here, touching his skin. Typically, in an Ebola treatment unit, we cut a slit right here, and you'd have your thumb that goes into this, into the Tyvek suit, okay? So that creates the seal. It creates your sleeves are very low down on your hand. So that's the first part. You'll have this glove, and it'll go through your Tyvek suit. This is your yellow Tyvek suit, impermeable to fluids. Okay. We also, looking at his whole uniform here, he's got this outer apron. Okay. Typically, the ones that I've seen, you can pull away. And these ones are like a permanent that they rewash and use again, okay? So these ones are reusable, but the ones that I've seen in the field are just ones that you can pull away and get away from your body, just as a separate barrier. Because these are very difficult to pull over your head, and you can see maybe some infection or some fluids could get on you as you're taking this off and doffing. So then, going through, he's got an N95 respirator mask on underneath. That's protecting any type of, like, we're worried about aerosol, maybe there's spray or fluid going through, just protecting your breathing right there. Then he's got his glasses on underneath, but he's got a face shield. This one is a reusable face shield. One that I've seen in the fields were just a single-use face shield that fit a little bit better with the hoods. Typically also, the Tyvexes that they're using now are white, and they have a hood that goes over the whole system, okay? So the hood would lock down over this whole system. But it looks like now what we have, the supplies we have here, is like a separate hood that's not attached anywhere, but we want to make sure it comes down. So I had him put his face mask on underneath, so this creates a seal, and anywhere like right here, even though it's going to create a lot more steam and a lot more fog inside his mask, it's going to protect him from fluids that may be coming in from the side or underneath this. And I wouldn't say that this is still an ideal setup with these. I prefer the hoods, the Tyvek hoods that come down and really lock it in close. But this is probably the best method based on these materials, based on what I think would protect you from fluids. Okay, on Ebola.
Normally the outer glove would be taped to
the outer glove, typically they'd have longer ones that I've seen, so they go way up here, and since this is locked in down here, this is not going to ride up, and you're going to have a glove that comes way up. Okay? In this situation with these short gloves, we could roll and maybe do some tape. It just might be a little bit difficult getting off of that and doffing. I have never taped with gloves like that before, but we could get some scissors here. We're working on getting some scissors and doing this properly so it's locked into place, okay? You really want to work with a good buddy as you're doing this the whole time, and before they walk in anywhere, we do full checks. Make sure that even not only Donald's written on them, but something like I'm a clinician or I'm a sprayer, or you have your job. So maybe I don't know Donald in here from anybody, but I know that he's a sprayer or that he's a nurse or he's a doctor, so I can get Donald's attention, know what he can do for me once we're inside the Ebola treatment. Okay? This might have some problems rolling around just the way that this hood is, but we want to make sure it's vision, because that's also a safety issue. Like, he's got to have good vision to be working in here.
And the boots are in case what?
So down on the boots here is also another layer of protection. Sorry, missed that. Typically we put socks on the bottom with your pants, put your boots on, and this Tyvek suit comes down underneath everything. Covers everything. Perfect. So those are all the, looks like all the different, we want to make sure everything's off, no wedding rings, no watches, nothing that could break with the barrier, okay? Glasses, I know they didn't want people to use contact lenses. Glasses, I think are okay as long as you can fit it with the type of equipment that we have.
Perfect. Thank you.